Emotion and motivation. We have about 550 words to describe the feelings we have. Emotions are biologically based responses to relevant situations, shaped by learning, and involves changes in peripheral physiology, expressive behavior, and subjective experience. Mood, diffuse, long-lasting emotional states. Emotion, immediate responses to a situation. Arousal. High, excited, tense. Low, calm, lethargic. Valence. Positive, elated, contented. Negative, sad, gloomy. First comes the bodily response to the situation, and second comes your mind interpreting your body's primary response. E.g. 1. If you hold a pencil with your mouth, your brain would interpret it as if you were smiling, which makes you happy. E.g. 2. If you move your face muscles into an expression of fear, your brain would interpret that you're afraid. But some people claim that both happens at the same time. Subjective experience plus body response. E.g. Shatter 1971. He injected people with adrenaline, raises heart rate, high arousal, or give them a placebo. But they just feel jumpy. But if you show them a horror movie, they will feel more fear. Or a comedy movie, they will feel more laughter, and so on. So, adrenaline amplify the intensity of the emotion, but the emotion was driven by the situation. But if you told them, we give you adrenaline and it usually amplifies stuff, then it disappeared. Creaky bridge experiment. 2 bridges. The first is a dangerous bridge. The second is a safe bridge. In the middle of each bridge is an attractive female. Then you ask the subjects to fill out a questionnaire. If the questionnaire has more questions, they can call her at home, and she will provide her phone number. As a result, more men will call her at home if they were on the dangerous bridge than on the safe bridge. Which means, dangerous bridge produces high arousal, increased adrenaline, which is misinterpreted as attraction. If you're in a high arousal situation, you move over that arousal into whatever it is you're encoding. Current view. Bodily response plus interpretation equals subjective experience. Are emotions inborn? Yes. Even people who born blind or deaf display the same expression, even though they haven't seen or hear somebody expression emotions. Are emotions universal? There are 6 universal emotions. Happy, sad, fear, anger, surprise, disgust. Westerners have a tough time knowing which expressions are displacing non-Westerners, and vice versa. Innate plus universal plus cultural overlay. Visual cliff. A baby is put into a box, at some point it seems there's a cliff, but in reality, there's plexiglass which makes that illusion. At the other end is his mother. If she's expressing a happy face, the baby will keep walking, 74%. If she's expressing a fearful face, the baby will stand still or even turn back, 100%. Are facial expressions completely random? No. When you express fear, your eyes get open, and your nostrils open, because you want to see and smell the more information possible, to see if you have to run, or fight, etc. When you express disgust, your eyes get shrink, and your nostrils close, because you want to see and smell the least, to just avoid that feeling. Facial expressions exaggerate or diminish sensory inputs that are relevant for the emotion. Brain basis of emotions. Amygdala equals fear. Sitting in front of the hippocampus, one on each side, and are the core elements of the limbic system, and it's made of bundles of nuclei, that have specific roles. Mice without amygdala doesn't fear cats. Monkeys with amygdala lesions, they get in big troubles because they don't know who they ought to be afraid. They lose their position in dominance hierarchies and become subordinate. And they might get rejected by other monkeys because they feel there's something wrong about him, they get isolated, and die earlier. Rhesus monkeys. Infants with amygdala lesions are fearless. Normal infants, if they see a novel object they will wait until his mother goes and look what it is. Infants with amygdala lesions go straight to see what that novel object is, and even if there's a snake, they will go to see what's that thing. Fear conditioning. Rats. A tone plus a shock equals fear response to the tone. If you lesion his amygdala, they can't learn to fear the tone. And when they get the shock, they jump like a normal rat. It's not that they can't feel pain, they can't learn that the tone predicts the shock. Patient SM. He had a disorder that calcified the amygdala early in development. They used a super loud boat horn, and preceded that with a gentle warning that it was coming. Patients with amygdala lesion doesn't produce a galvanic skin response to the bad tone. But they can tell you afterwards what happened, but their body don't learn that association. If a patient has hippocampal damage, their body learns that association, but they don't remember it afterwards consciously. Hippocampus equals learns facts. Amygdala equals bodily response. Your amygdala can learn that something is dangerous, without going through that experience, but just by seeing or hearing that something is fearful. People remember better a history when something highly arousing happened. Emotion is amplifying memory. And patients with amygdala lesion don't have that memory bump based on emotion. Patients with amygdala damage have trouble in recognizing fearful facial expressions. Amygdala, learning plus memory plus perception of faces related to fear. Freud said, emotions are happening under our conscious awareness. That's true. If you show subliminal fearful faces vs happy faces, the amygdala turns on. Also, cortical blindness. Patients who are blind in one visual field. If you show them a fearful stimulus in his cortically blind field, the amygdala turns on. And people speculate that because fear is survival and danger, we might have a superhighway of information that sends dangerous information immediately to our amygdala, even before you process the rest of the information. Insula equals disgust. Disgust might be a good signal for contaminated food, things to avoid that make you sick. Also, patients with lesions in the insula don't recognize facial expressions of disgust. Amygdala is unimportant for neutral information. Amygdala is important to remember things with high arousal. It also applied to positive stimuli. Also, women have better memory than men. Better recall of emotional life events. Faster production of autobiographical memories to cues. More accurate in dating memories. Wives score higher on vividness of memories for first date, last vacation, recent argument, etc. For men, the more the right amygdala is turned on, they remember better negative films. For women, the more left amygdala is turned on, they remember better negative films. Also, women rate as more negative things that are negative. If you show them terrible images, women will rate as 1, most negative, while men will rate as 3, negative. The more intense they rate it, the more they turn on their left amygdala. But also, right hemisphere equals better memory in men. Left hemisphere equals better memory in women. Image 57:20. Which means, women on average, there's more overlap between the parts of the brain engaged as you evaluate something, and the parts of the brain that make the memory of that. But brain imagining doesn't prove it's due to hardwired and genetics, or consequence of socialization. But we know that we are hugely influenced by social influences on what it's to be a male or a female in our families, cultures, etc. And we can't tell those two things apart. We can't tell if it's social or genetic at all.